Sarah Josephine Baker. He was born on November 15, 1873 to February 22, 1945. He was an American physician notable for making contributions to public health, especially in the immigrant communities of New York City. Her fight against the damage that widespread urban poverty and ignorance caused to children, especially newborns, is perhaps her most lasting legacy. In 1917, she noted that babies born in the United States faced a higher mortality rate than soldiers fighting in World War I. Drawing a great deal of attention to a cause, she also is known for twice tracking down Mary Mallon, the infamous index case known as Typhoid Mary becomes a doctor. When Baker was 16 years old, both her father and brother died in a typhoid epidemic. Devastated, she abandoned plans for attending Vassar and decided to go directly to New York Women's Medical College. She was determined to become a doctor in order to help support her mother and sister. In 1898, after 4 years of intensive study, Baker graduated second in a class of 18. She interned or gained practical experience in medicine at the New England Hospital for Women and Children, an outpatient clinic serving residents in one of the worst slums in Boston, Massachusetts. Later, she moved to New York City with her roommate and fellow intern, where they set up a practice near Central Park West. Unable to make ends meet, Baker took a job as a medical inspector for the New York City Department of Health. She examined sick children in schools and worked towards controlling the spread of contagious disease. First woman health official. In 1902, Baker was given the job of searching for sick infants in Hell's Kitchen, located near the docks of Manhattan West Side. Hell's Kitchen was a slum area where 1,500 children were dying each week of dysentery, a disease that causes severe diarrhea and dehydration. In 1908, the Department of Health established a division of child hygiene with Baker as its director. She was the first woman in the United States to hold an executive position in a health department. There, she shaped policies for innovative health reform and made preventive medicine and health education the responsibility of government. As Baker's program saved the lives of countless infants, she revolutionized pediatric healthcare in the United States and in other nations as well. Her innovative projects. One of Baker's projects was establishing milk stations throughout the city where nurses examined babies, dispensed low cost, high quality milk, and scheduled checkups. In 1911 alone, 15 milk stations prevented more than 10,000 deaths, and the next year, 40 more stations were opened. Another of Baker's program was the training and license of midwives or persons who assist women in childbirth. Since many immigrant women were used to midwifery, they were reluctant to allow their babies to be delivered by male doctors in hospitals. Midwives were often unqualified, however, and the infant death rate was high. Baker instituted a mandatory licensing program with results so successful that she was able to demonstrate the rates of infection for home deliveries were lower than those for hospitals. Baker also started a program called the Little Mothers League to train young girls in the care of babies. Since many girls were put in charge of their younger siblings while their mothers worked, through this program, nurses instructed schoolgirls in the feeding, exercising, dressing, and general care of infants. And even more significant methods of reducing infant mortality was a foster care system Baker founded to give orphan babies a better environment than that available in institutions. Her efforts helped reduce death rates from one half to one third of infants born in a year. She also introduced the concept of prenatal care to prevent infant mortality during and following childbirth. Contributions. Among Baker's other accomplishments were a school inspection system and the organization and streamlining of record-keeping procedures for health department, which was adopted nationwide. She opened specialized clinics and instituted parent training by public health nurses. In 1912, she established the Federal Children's Bureau and made plans for creating a division of child hygiene in every state. Besides being a leader in the medical field, Baker was in the forefront of the fledgling women's movement. In 1950, she was invited by officials at the New York University Medical College to lecture on child hygiene for a new course leading to a degree of Doctor of Public Health. Since she did not have an actual degree in the field of public health herself, she offered to teach in return for the opportunity to earn the diploma. When Dean William Park turned down her request on the grounds that the medical school did not admit women, Baker refused the appointment. Park searched in vain for a year for another instructor, finally giving up and admitting Baker and other women to the program. Baker's reception by some of the male students was hostile, but she continued teaching at New York University for 15 years. Along with five other women, Baker founded the College Equal Suffrage League, an organization that campaigned for women's voting rights, and she marched in the fifth annual Fifth Avenue Suffrage Parade. Death: Sarah Josephine Baker died from cancer on February 22, 1945, in New York City.